Okay, we're going to do a real exciting course today, and it has to do with the facial turbinates, okay, and also the eyes. But this is specifically on cranial facial release, and we're going to do some eye therapy with the Sananga medicine from the Amazon. And first thing is I want to introduce Dr. Nick Tanchev, who's the medical director of the Earth Academy retreats. And he's going to go ahead and actually perform this therapy, which is really, most likely you've never seen it before, ever. And I used to do this therapy in my office 20 years ago to probably 50% of the people. And this is specifically, as Dr. Nick will go ahead and explain, but this is specifically to open up all of the facial internal turbinates, which of course when we breathe, most people when they breathe, they do not breathe through their nose correctly is because the nasal passages in their nose, okay, have been deviated septum. Maybe you've used a lot of nasal sprays in your nose and everything's really hard inside. You may live in the desert and it's very dry and it's got a lot of different scar tissue in your nose. Okay, a lot of people have pulled just hairs out of their nose and caused little infections inside to cause the turbinates to get smaller. So what this does here, as Dr. Nick will explain, is that this is going to stretch out all the turbinates. He'll go over with the sinuses, because there's several sinuses in the face. And again, this is a therapy, okay, specifically for the front of the face, the nose and the eyes, they go together. Of course, we do therapies on the ears, okay, therapies on hands and feet, therapies on your skin, therapies maybe to do with enemas. So this is one of the therapies that has to do with your supercomputer, because this has a lot to do with on how you feel, the way you breathe. If you can't breathe through your nose, then you're breathing with your chest, with your mouth. And a chi breathing exercises that I really try to teach everybody to do is that if you don't breathe through your nose correctly, then of course it's only because maybe your turbinates don't really work correctly. So a lot of people have headaches, a lot of people have eye strain, or just feel like they have pressure in their head. This really helps everybody that I've ever done this to, okay, just feels immediate release. And that's the best part of this therapy. But before I hand this over to Dr. Nick, he's going to also tell you, and this is, you know, very beautiful type of herb that is used in the eyes. It can be used for several things, but I also learned this in the Amazon, is because this is one of the best ways to clean the eyes when this therapy is done. You can do them separately, which we'll go into it later on specifics on Sananga. And I found out, Dr. Nick's found out, that, you know, when you start, no matter who you're talking with, collective therapies sometimes really makes the therapies work way better. Instead of just doing an enema, well, if you were fasting while you were doing an enema and maybe doing the oregano therapies for cleaning the small intestine, well, these are collective therapies. And maybe now you're using the sauna. Maybe now you're drinking distilled water. Maybe now you're stopping putting cell phones up to your head. These are all like different parts of what we call innate intelligence, okay? And that just lets the body so it can heal itself. Because I'm not a healer, Dr. Nick's not a healer. I don't want anybody to think that. Remember, we're trying to heal ourselves, okay? But the body is self-organizing, it's really smart, and as long as we guide it, okay, to take out some of the things it doesn't need and put in some of the things it does need, then it will rebuild itself, okay? Somewhat. But you still have to dissolve, wash, and renutrify your body. You still have to be able to upgrade, enhance, and optimize. It's not just doing some work, but it's also changing things in your house. Remember, this is terrain modification. And it's also, you know, trying to reset, renew, and rebuild yourself. And these are just ideas that you put in your head. And it's a long road, but it's a fun road. And the face, okay, he's going to do this therapy on me just to show you on how this is done. And like I said, I wish more medical practitioners, chiropractic practitioners, any medical practitioner, you can get certified. You're not just doing something, you know, that you just read in a book yesterday. Okay, this is something that's a very proven therapy that has been done for many years. So we're just bringing this to the forefront again to have people. Has anybody ever heard of cranial facial release therapy before? Have you ever seen it done, or have you ever had it done? That's pretty good. We got about 10 people in here, and not one person has either heard of it, okay, or even seen it performed or had it done to themselves. Has anybody used Sananga? medicine on their eyes. Okay, 2 people, 3, 4, 5, okay, 6. Okay, so we've had some people here with that. But I'm going to hand this over to Dr. Nick now. And like I said, he's going to do a therapy on me, just like we're going to do on part 2. Everybody here is going to go through the protocols. And we have younger people here. We have some, older people, like over 50 years old, like my generation is what I call it. And the older you get, the stiffer everything gets inside. And the younger you are, even though you're young, it doesn't matter. A lot of people have hit their nose. I mean, I broke my nose, look how crooked it is. I've had 5 surgeries on my nose. Okay, so I'm just going to show you. Watch. I can breathe like maybe 20% in this nose, maybe 30, let's just say. Give it good, watch. You can see my nostril collapses. Now, watch this side, totally deviated. I can't breathe it at all. Okay, watch. Nothing. Pretty good. Okay, so the turbinates inside need to be stretched. Dr. Nick, last time you did this on me, what, maybe a year ago?
More than that, 1.5 years, I would say.
And who did yours?
Dr. Adam Del Torto.
Oh, I did yours that night too. Oh. We traded this. No, that's okay.
I was thinking about the prior time. Yeah, right.
And I haven't had it done, just so you know, because I don't have anybody to do these treatments with. It's like, the practitioners really a lot of times don't get worked on themselves. So when you find somebody to work on you, and a lot of people really don't want to, because practitioners sometimes don't like working on practitioners because everybody's trying to judge each other to see if they know something or more than the other people. But I don't let anybody really touch me. Dr. Nick, I let him adjust me, let him do dry needling, let him do all different therapies, deep alters, all things that basically, unless you're a seasoned practitioner, then realistically you may be doing some of these therapies, but you need thousands of people of practice first before you can even feel confident and know what it does, so you know what it does. See, I know this nasal, the cranial facial release, and using the Sananga therapy works wonders. And I've very rarely had people basically, and it doesn't feel good, either one. But, sometimes I used to have to do this maybe 2-3 times for people, to come in consistently. But all I know is he's going to do this to me, and it's going to open up my passages again, miraculously. Okay, I'm going to hand this over to Dr. Nick here, and he's going to say a few words here before he puts this balloon in my nose. Actually, let me hook it on for you.
Okay, so I am Dr. Nicholas Tanchev, and I am going to go through this amazing therapy. And what we did here at Earther Academy Retreats was he speaks my language in the fact that the combination of the therapies is what makes what we do so powerful. Okay, we can do just cranial facial release, which is powerful all by itself. We can do Sananga all by itself, but when we combine it, because Sananga is typically considered for the eyes, but when we open up the entire face, now that Sananga will reach even deeper. And it's more than just treating the eyes, it's treating the entire face that's already been opened up as well. Okay? So right now what I want to do is I want to go through more of the purpose of why we would do cranial facial release, because it's an intense thing to consider why we would put balloons through the turbinates of our nose.
Show them the instrument.
Okay.
I never got a chance to show them the instrument. Just so everybody knows, that's never seen even the instrument on how to do this. This is a balloon.
Yeah. So we use tiny balloons. Okay.
That's blowing up inside your turbinates. Remember that.
Okay. So number one, what happens, because what we are targeting is we are targeting the sphenoid bone. If you can look at this diagram, what you'll see is that you have 3 turbinate openings on both your left and your right side. So that's 6 openings. You have lower, middle, and upper. And where do they all end up at the end is right there at the target, okay? We're targeting the sphenoid bone. The sphenoid bone is what attaches your face to your cranium, okay? And what is inside the sphenoid bone that is super important for many functions of your body? Can anyone think of a gland that is super important for many different functions that need to happen in your body to function optimally for you to have optimal health?
It's in your head. Guess which one? Pituitary.
Okay. So we are stimulating pituitary gland on a major level by doing this therapy. Okay. So there's many reasons why we do this, but let's at least consider all of the functions of what we can stimulate by doing this therapy that are a part of the pituitary gland. Okay? Hormones. Male and female hormones. Okay? So we have the sex hormones. What else? We have the thyroid gland that is stimulated as a result of pituitary function. Okay? Thyroid affects our metabolic function, temperature regulation. Okay? What else? Pituitary gland.
Give you a hint. Remember, the pituitary gland lets out 7 different master functions.
Growth hormone.
7. 5 in the front, 2 or 5 in the back, 2 in the front. They call post-pituitary and anterior pituitary. And this is, remember, this is the master gland. Okay? And this is the one that's center in the middle of your head, and this is very important to keep active. If not, you don't make the chemicals he's talking about to feel good, hormones to regenerate, okay, just to be able to make yourself so you feel sort of what we call human. Okay, is the pituitary gland. And once it gets calcified, once it stops functioning, once the nasal turbinates, everything gets stiff, this is part of why a lot of people have a lot of problems in their head, depression. So this is, yeah, the pituitary is, like one piece, but, this opens up all the cranial facial movements immediately.
Okay. So this therapy is going to help to mobilize the. Does everyone understand? Actually, this is important for you guys to realize. Your skull, the cranium, is made up of 22 separate bones that are the joints that separate these bones are called suture joints. They look like okay, So these need to move and be able to be mobilized to function at their best, okay? It's even important during respiration, expiration, okay? When something is calcified and fixated in our skull, okay, this affects blood flow, it affects how healthy of function our brain is, okay, which is underneath our skull, okay? So we are mobilizing the cranial sutures, we are unlocking cranial fixations that are a result of, as we age, calcification, okay? We're preventing neurodegenerative disease, okay? We are not necessarily curing neurodegenerative disease. However, this therapy was pioneered by a doctor who got results treating children that had neurological disease, okay? Was able to improve their condition of Down syndrome, cerebral palsy, autism, these different childhood neurological diseases, okay? So we don't talk about curing, however, potentially it can help someone who already has a neurological disease, but definitely we are wanting to prevent. We're increasing blood flow to the brain. We're increasing cerebral spinal fluid to the brain, okay? And all of these very, very important functions. So the other...
One quick thing, hold your thought. Look, just so you know, guys, look, your brain, because this is all important. Every time you breathe, your sutures go out like this normally. They have to. If they're fused together, you got problems. You don't like exercising. Every time you let your air out, the sutures go in and out. I breathe in, they stretch out, I let it out. Remember, we have different therapies. Just showed you smashing the top of your head, that's the cranial therapy. And if all this here is all tight, these don't even want to work because you're not breathing through your nose. So this is just super important. People that I see all the time, okay, that especially don't exercise, they're breathing through their chest all the time with their mouth. Because usually this doesn't breathe too well, okay? Or they're just forgetting how to breathe only through their nose if they can. So breathing through your nose, remember, if under normal circumstances, your brain still opens up. But when you really exercise, do the chi breathing, breathing through your nose only, this opens up and it's a therapy for your brain. But you got to go ahead and make sure, we're talking about, you're opening up every section, the ear, the face, the top of the cranium and the skull, getting the joints and the neck manipulated. Okay, I haven't been adjusted in so long, and he adjusted me the other day. I mean, geez. Okay, everybody needs to get joint mobilization in every part of your body. And the cranium, like we said, this is everything to do with your regeneration, because as above, so below. This is the supercomputer. And so this therapy is like, just so everybody knows, this is super important, and it's really like a hidden technology, or what I call suppressed technology. It's because why? Because every doctor should know how to do this, and should be practicing to figure out how to make, better instruments. And this is the way they sell these things, how to make them. This is just a blood pressure cuff that's been, designed, and they, it's the way they sell them to be able to do this therapy. And, it's all pioneering, no matter what, is because it's very, like I said, you guys are already high involved into health a little bit and whatever it is, and no one's really heard of this. So it's a hidden, suppressed technology. And so, like I said, he's going to do this on me, and that's why I said, shoot, I'll be the first person for you to do here, so everybody can really see.
So in today's times, also, what this therapy is going to be very, very useful for is you're going to feel very open, and your breathing capacity is going to be enhanced and increased on another level. Okay, so just like what he mentioned, and I'll have everybody do this before I do the therapy on you as an individual, is I'm going to have you obstruct one nostril and try to take a super deep breath through one side and also the other side. And I want you to be able to feel the difference, if there is any difference. Not everybody may potentially have any difference between left and right, but most of us do. Like for me, my nose deviates to the right, and I have more obstruction, boom, right here. So when I go, barely, nothing. I need this, right? And then this side.
It's the same as me. One side works.
So, and oftentimes people ask me, well, doctor, how many times do I have to do this? So I explain to people in the beginning, in the beginning, it's highly recommended that we go through all 6 openings.
They can see it better from the camera.
We go through all 6 openings initially, And then oftentimes, when you do the 6 openings, which is the lower, middle, and upper on both left and right side, there might be 1 or 2 openings that were more difficult than the others, So the 4th session might be going back to what we would call the major areas that needed more attention, and open those up a second time, okay? And then, well, is that good for the rest of my life? Well, yeah, I mean, some people are gonna be like, wow, that totally changed me for the rest of my life. You know what I mean?
For like a year.
And it does, it does. But like everything in life that I've been repetitively explaining to you guys is all the therapies we're showing you, there's always needs to be some maintenance for optimal results, okay? This idea we do it one time and now I'm fixed for the rest of my life, hey, come on.
Like doing fast one time. No, it's a constant type of lifestyle.
We need to maintain the therapies that we're going through now. Maybe not as aggressive as the beginning. The beginning we go through 4 sessions aggressively. Maybe in time now we can do some openings just as maintenance, but not as aggressively. Okay, any other questions? I think we're good on understanding the purpose of how effective this can be in multiple different ways for people.
That's a big cave in there. Look at that thing.
Yeah, it totally is.
That's a big cave. And remember, lots of things that live in there also.
So so a lot of people who want this therapy, as one of my patients, is people who have sinus problems, okay, breathing problems, okay. This will totally clear people because immediately they will have the release and opening and drainage of all that
eye congestion,
blockage that they're constantly dealing with. There's so many people that complain of sinus congestion and chronic sinus infection. Does anyone here have any of those issues or has had in the past? Yeah? And how many people have known of people to come in and say, oh, my sinuses are congested? And so many people I've experienced complain of the sinuses. Mm-hmm. Has anyone ever heard of anyone saying my sinuses are congested and they have, or they call it allergies, these different types of things? Yeah? Yeah, it's pretty common. So this is a really good therapy for people that have any of these complaints. Okay. Any other questions? Otherwise, we'll move on to the actual therapy side of things.